Okay, just to begin with, since the recording has started, thank you very much, Brother Hasim, to give a brief introduction about me and Dr. Shezoon Mohideen. Alhamdulillah, I assume that this is a third meeting or third conference which is happening before the Ramadan. I understand is one of the important area people should aware of, all over the world. The people have a chronic diseases and some other mental health issues, and they are on various medications. So this is one of the awareness program, and also this platform can be used as general information, and also the personal questions if anyone has, that you can even personally contact, or if individual questions, if you have kind of health related matters, you should approach your medical practitioner. So this program is initially how we are going to run. Is the first after my introduction, Dr. Shezoon Mohideen will present about 15-20 minutes. And once that finishes, probably we will give some time for a participant to ask questions or any clarification on the talks or any further informations. Some of the areas, is still, in the medical problems. However, there are Islamic perspective in it. We will try and include, some of the Sharia scholars' opinions, and also the Madhab opinion as well, if there is any need for it. The majority of the stuff we will include here is generally people aware and also how the chronic condition best managed during the fasting without having any medical issues for themselves. So just to begin with, I would like to introduce our speaker. She is Dr. Fathima Shezoon Mohideen. She is a senior consultant in family medicine in Qatar. She works for a primary care corporation called PHCC, and also she is a very prominent speaker in Qatar and some other part of the world as well. She has very good experience in managing the chronic medical conditions. There is something in Qatar, as I used to work in there is something called NCD, so non-communicable disease clinic. We see all the chronic diseases. So this is the good opportunity to use Dr. Shezoon Mohideen, since she is a practitioner there. She will give some best tips and input how to manage chronic condition during the fasting. So Dr. Shezoon, you can start from now.
Assalamu alaikum, everyone. First of all, I'd like to thank Jawahir for that introduction, and the World Forum for Sri Lankan Muslims for giving me this opportunity. And before I start, I'd like to declare that I have no conflict of interest. Do you see the slides? Can you see my presentation?
Yes, we can see, yeah.
Yes.
Okay, so today's topic is about safe fasting in long-term health conditions. Before we proceed to the main part, I'd just like to take you through the overview of today's discussion. So I'll be talking a little about what fasting is, how fasting actually affects our bodies, a few healthy tips on food, and also whether the myths about fasting and physical activity. And then we come to the main part of our discussion today, which is fasting in chronic long-term medical conditions. Obviously, we cannot cover all of the chronic medical conditions, so I've selected a few most commonly seen medical conditions like diabetes, high blood pressure, heart problems, kidney problems, liver diseases, and asthma. And if there are any women that are joined here today, then I'll be talking to you a little about fasting in pregnancy and breastfeeding. And then my final take-home message to all of you before we actually open the floor for questions. So a little facts about fasting. I'm sure all of you know fasting involves abstaining from food, drink, smoking, and marital relations from Fajr to Maghrib. And the purpose is to cultivate self-discipline, self-control, and empathy for the less fortunate. It encourages reflection, prayer, and closer connection to Allah. So, as we know, fasting is obligatory upon all Muslims, except for children under the age of puberty, women who are pregnant, lactating, or menstruating. If you're very old, frail, ill, or if you're insane, and if you're a traveler. And the duration varies from anything between 11 to 18 hours, depending on where your geographic location is and the season. So, there are several health benefits of fasting. Now, fasting during Ramadan is not just a religious practice, but it's a powerful holistic reset of the body and mind, from weight loss and detoxification to improved brain function and a stronger immune system. The benefits are scientifically backed and significant. And by the end of Ramadan, many people will experience greater energy levels, improved digestion, mental clarity, and an overall sense of well being. So I've listed loads of benefits here, but I've just given you an outline of how it can actually help you right from weight loss to improving your mental well being. Now, I'd like to spend a few minutes on the effects of fasting on your body because I really think this is very important for you to understand what actually happens to you normally and what happens to your body when you are fasting. Because understanding is really important because that's when you will actually follow the dietary advice. So, if you look at the picture on the left, it shows you what actually happens when we eat. So, when we eat food, it is broken down into glucose. If you have carbohydrates, it's broken down into glucose. But if you have fatty foods, then it's broken down into fats, and protein, they're broken down into amino acids. But I'm going to concentrate on the breakdown of glucose, which is essentially sugars. So when it's broken down into glucose, the glucose enters your bloodstream, actually raising your blood sugar levels. And in response to this, an organ known as the pancreas releases insulin, a hormone that actually helps the glucose to enter your cells. You can consider insulin like the key to a door that actually opens up and helps the glucose to enter your cells, which then provides you with the energy required for various functions in your body. So when this insulin, glucose is then used, and then when you have excess glucose, this is then stored in your liver and in your muscles for later use. And when you have excess of this, it is also stored in your fat for long-term storage. So what happens when you're actually fasting? If you just follow me on the right diagram, you can see when you don't have food, then you don't have much glucose in your body, your insulin level drops. And what happens at this point is that the glycogen, which is actually stored in your liver and muscle, is then broken down, converts into glucose, and this glucose is then used to provide you the energy during the time that you are fasting. If you have prolonged periods of fasting, then obviously the fat is then broken down to provide you with the energy. So this is where it is really important for you to follow a healthy diet, because most of you will say that, well, I'm fasting, but I still gain weight. So this is the reason why it happens. So if you look at the entire picture of fasting, when you initially fast in the first 0 to 12 hours, your body still has a bit of glucose from the last meal. And then it starts to use that storage that we talked about before from your liver to maintain your blood sugar levels. And the insulin levels drops in your body. And after a certain point, when you extend your fasting beyond 12 to 16 hours, your stored glycogen also decreases. And then you start to burn your fat. Your fat starts to burn down. And the liver converts this fat into fatty acids and ketones, which is an alternative form of fuel. So your metabolism has to do some adjustments when you're fasting.
Get to go in the front.
Can I just request you to mute your mics? And then, obviously, when you break your fast, that's during iftar time, then your blood sugar rises again and your glucose gets absorbed, and then your pancreas releases insulin. And if you have excessive food that is consumed, then it stores as fat. So that's for you to really understand why some people gain weight and some people lose weight. So I'm just going to give you some healthy food tips for Ramadan. This will apply to all diseases in general and all of you who have no chronic diseases as well. So the first tip is to break your fast with dates and eat after your Maghrib prayer. So the reason I say this is because after a long period of fasting, the stomach is not yet ready to digest a fatty meal. And this can overburden your digestive system. Now, the dates are quickly and easily absorbed through your stomach lining because they contain a simple form of sugar as glucose or fructose that do not require complicated process. They are simple sugars, unlike when it breaks down the heavy carbohydrates and fats. So let your stomach rest during prayer in preparation for the food that you're going to have. And the second tip is really make healthy choices and avoid overeating. Otherwise, the body will start to store excess calories and fat. And the third tip is do not skip suhoor because it is the energy producing meal. It actually fulfills the fasting person's nutritional needs and helps him complete his fast. And the fourth tip is follow the 3 meal rule. I'm sure you must be wondering what is this 3 meals when we are fasting. So a dietary rule is to eat 3 meals a day, and it should not be different during Ramadan. So suhoor refers to the breakfast meal consumed in the morning. Iftar will be equivalent to your dinner, and the light meal is between the two that will serve as supper. This actually helps to regulate your body functions and to fulfill its dietary needs. And of course, don't forget the bit of water the plenty of water that you need to have. And the fifth tip is to consume plenty of vegetables and fruits, at least 5 servings of fruits and vegetables per day over the 3 meals, because it will provide you with the nutrients and also contribute to feeling of fullness and also help with your bowels. Sixth tip is to reduce your intake of sweets, particularly those that are high in fat, sugars, and calories. They will provide you with a large amount of sugars, and we should really use these 30 days. If you're serious about losing weight, then use this as one of the stepping stones. And the final tip is drink a large amount of water to avoid you from getting dehydrated. What we recommend is usually about 2 to 3 liters, which accounts for approximately 8 to 12 cups. So I'm going to quickly run through what foods are good. Like complex carbohydrates, this is not an exhaustive list, but a few ideas for you to when you plan your meals: oats, whole wheat, brown rice, protein-rich foods like egg, yogurt, beans, which will help to build your muscles and keep you full throughout the day. And then healthy foods like avocados, healthy fats actually, like avocados, nuts, seeds, and some hydrating foods like watermelon, cucumber, oranges, and coconut water that will help to keep you dehydrated throughout the day, prevent you from dehydration. So what are the foods to actually limit? Are fried and fatty foods like potatoes, samosas. They are quite high. They actually make you feel very tired and exhausted. So foods with high amounts of salt, such as pickles, can add to the dehydration. And foods which are large in sugars will provide you with a source of energy, but they're very short-lived. And foods that contains caffeine, I know we tend to drink a lot of coffee and tea. These act as a diuretic and cause your body to lose a lot of fluids and salts. So therefore, try to avoid drinking too much of these. Now, there's several myths about physical activity, so I thought it's really important that I talk about this. Physical activity is actually good even during Ramadan, provided you're quite healthy and you don't have any kind of diseases that prevent it. So if you're in doubt, just see your doctor. But otherwise, when is the best time for a person to fast or work out? So it can happen either before iftar or after, before iftar, or after iftar. So if you are actually doing any form of exercise before iftar, just try and limit it to no longer than 60 minutes. Try to do it in a cooler place, especially during the summer months, and drink plenty of fluids after, iftar. But if you're doing exercise after iftar, try to do it after 3 to 4 hours at least, because you want your digestive process to be completed, and also make sure that you do it in a cool place, particularly during the summer months. So some tips and guidance for exercise during Ramadan is to perform physical activity for 30 minutes at least every day in a cool place. Avoid aggressive and high intensity exercises during the day when you're fasting. Work out either just before iftar or 2 to 3 hours after. Avoid physical activity immediately after you break fast, because all of the body's energy is directed towards digesting your food. And if you have any doubt, just please see your doctor who knows you better. And stop if you experience any kind of dizziness, nausea, or difficulty in breathing or chest pains. And drink plenty of fluids between iftar and suhoor to avoid dehydration. So now we come to the main part of our lecture today, which is diabetes in one of the commonest chronic conditions, fasting in one of the commonest chronic conditions, which is diabetes. And diabetes, as you know, is a condition where the body fails to actually process your blood sugar in a normal way. I'm not going to go into much detail. I know if you're diabetics, you probably know about your condition. But the question most of you have is, can I actually fast if I'm a diabetic? So my general advice, obviously, we will be talking to you in detail about diabetes over the next few slides. But my general advice is, if you're diabetic, then please do see your family physician or your GP, who can give you tailored advice based on your medical condition, as they know your history very well, because some of them will have chronic conditions, not just diabetes, other chronic conditions that will prevent them from fasting. The advice that I'm giving you today is a general guidance. It might not fit everyone based on your we have to have an individualized plan for each and everyone. That's why I'm insisting on this. So because your doctor has to actually tailor your medications, adjust your medications, tell you the timing, how to actually monitor your blood sugar, and give you a tailored meal plan depending on your medical condition. In general, I would say people with type 1 diabetes who are dependent on insulin, it is highly recommended that you do not fast. Another group of people that should not fast is those who have poorly controlled type 2 diabetes, elderly patients who require insulin, children who are under the age of puberty who are diabetic, and the very ill, frail people are recommended not to fast. And I know many of you will fast, even if there are so many conditions, some of them really insist to fast. Now, fasting is also not recommended for pregnant women who need insulin, and for breastfeeding mothers, whether they may have type 1 or type 2 diabetes. It is also not recommended if your diabetes is not very controlled, and some of you might experience episodes of hypoglycemia where your blood sugar goes very low or your blood sugar goes very high. If you're somebody who experiences these frequently, then it is not recommended that you fast. Now, diabetics with other chronic conditions or complications like kidney problems, heart problems, it is also recommended that you do not fast. However, having said all of that, most of the type 2 diabetics that are controlled are able to fast without much complications. But you will need a little bit of dietary adjustments and also medication adjustments. And obviously, you will have to monitor your blood sugar levels very frequently. So now the reason we are so cautious about diabetes and fasting is because there's a lot of risks while you fast. One of the most commonest risks that diabetes encounter is where your blood sugar goes very low, which is called as hypoglycemia. And this is when your blood sugar drops below 70 milligrams. You will sometimes experience signs like shaking, sweating, dizziness, confusion, And often it can lead to life-threatening situations like where you end up in a coma. So if you do experience such conditions while you're fasting, then you need to actually break fast immediately. So what I can advise for those people to avoid this is to monitor your blood sugar regularly, have a balanced suhoor with complex carbohydrates and proteins. And if you experience any of these, just break your fast straight away. Now, another complication that we often see, not as much, is with the blood sugar levels go very high. And this usually happens is when you eat a lot of carbohydrates and sugary foods at iftar. So we normally say hyperglycemia or very high blood sugar levels if your blood sugar rises above 300. And what the symptoms you often experience is you feel very thirsty. You might feel that you frequently urinate. You might get a bit of headache, feeling tired, blurred vision. And in these circumstances, then you obviously need to break fast. And to prevent this, you need to really avoid having excessive sweets, a lot of carbohydrates, white breads, fried foods at iftar, and take your diabetic medications as prescribed by your doctor. Another common complication that we see is not as common, but it can, what we call as diabetic ketoacidosis. So this is a serious risk of usually people with type 1 diabetes. That is one of the main reasons we actually advise people with type 1 diabetics not to fast. So what happens is when insulin is too low, your body burns fat, like we discussed in one of the slides. And this causes a buildup of acids in your blood. And this can be quite life-threatening, and it is actually a medical emergency. So, and the symptoms that people actually experience is extremes of thirst, nausea, vomiting. You might get a fruity smelling breath, and also you get very confused. And sometimes people end up in a coma. So another common complication that we frequently see is dehydration and your electrolyte imbalance. This happens because you don't drink enough water. And when the weather is hot, it makes it even worse. And some of the symptoms are you get dry mouth, dizziness, fatigue, your urine becomes darker, and you get confused. And as you know, dehydration can also exacerbate the kidney problems, and often people end up in heat strokes. So to prevent this, you need to drink plenty of water between iftar and suhoor, eat hydrating foods like watermelon, cucumber, yogurt, and avoid drinking too much of caffeine because it can increase or worsen the dehydration. I haven't added the other risk associated with this, but there's also a risk where they believe that you might get, but there is obviously enough scientific research to show that people also at increased risk of developing clots because of dehydration and high blood sugars, and then puts you at risk of getting strokes, heart attacks, and kidney damage. Now, just a few guidelines for diabetics who want to have a safe experience during fasting is to see your doctor to adjust your medication. In the slides later on, I'll give you a little bit of a guide. Obviously, we can't cover all the medications. And I also want you to monitor your blood sugars regularly before suhoor, midday, and before iftar. And please break your fast immediately if your blood sugar drops below 70 or rises above 300, because this is the extremes of blood sugar levels, or if you feel very weak, dizzy, confused, or you feel faintish. Listen to your body. Stay hydrated, drink at least 8 to 10 glasses of water between iftar and suhoor. Avoid having sugary and fried foods because they can cause your blood sugar to spike. And eat a balanced meal consists of protein, fibers, healthy fats to sustain your energy levels. Now, one of the actual reasons, this is actually not for you, it's too complicated, but I've just put it just to show you that as doctors, we have tools to help us decide, whether you're a suitable candidate to fast or not. This is actually from the Diabetic Association, where they have given us tools to help us to decide whether a patient should fast or not. And we have a very holistic approach. We don't only look at Is this patient type 1 or type 2? We look at the duration of diabetes, whether you have episodes of hypoglycemia, how's your blood sugar control. We look at what treatments you use for diabetes and whether you're somebody who's advised to monitor your blood sugar levels regularly. We look at whether you've had hospital admissions, whether you have complications of diabetes. And we also look at your cognitive ability, whether you are frail. We also look at what your job involves, and we take into consideration and the hours of fasting. So we look at loads of, parameters when we actually make a decision and tell you whether it's okay for you to fast or not. So that's the reason I, was reiterating that you should see your doctor, because it differs based on your individual situation, that we then categorize you as this is just a representation to know. We use these calculators to decide whether you are high risk, low risk, or medium risk. Generally, low risk individuals, you can fast safely. But if you're moderate or high risk, then we generally recommend that you do not fast. But from experience, we do see a lot of patients who insist on fasting, and then we've got to actually take extra care and give them individualized plans to help them to have a better experience during fasting. Now, if you want to take a screenshot of this, you can do so. This is just a guide of how to adjust your medications. It's not a very exhaustive list because I can't cover all the medications, but I'm happy to share it with anybody that wants to. But I will go through, this is how we do the medication adjustments. I'm just going to talk to you about a very commonly used medication that we use for diabetes, which is metformin. And the column in the middle where it says regime just tells that you're currently, if you're on once daily, then it is recommended that you don't have to change your metformin dose. You can just take it after iftar. But if you're taking it twice a day, then we recommend you to take it after iftar and at iftar and suhoor. And if you're taking it 3 times a day, then you take your morning dose after suhoor, and you can combine the afternoon and the evening dose and take it after iftar. What I notice, the common mistake that people do is if they're taking 3 times a day, they skip the middle dose. But what we usually recommend is to combine the 2 doses and take it after iftar. Now, some people are on metformin, the long release metformin, then you can take it after iftar. Then there's a drug called acarbose that it really doesn't matter when you take. You can either take it at iftar or suhoor. If you're on pioglitazone, then you can take it with iftar. If you're on a drug called semaglutide, you can take it after iftar, but it is recommended you take it with, soon after iftar with 2 to 3 sips of water. And the reason we say this is because the absorption of each drug is different. So that's why you see a difference in the way you take the medications. But generally, after iftar and after suhoor works for most of the medications. I want to put, if you're on an SGLT2 inhibitor, those are the drugs like dapagliflozin, canagliflozin, empagliflozin. Then you take it at iftar, but keep dehydrated. But if you're on a category of drugs called DPP4 inhibitors, I think it's for example, there are drugs like sitagliptin, vildagliptin, saxagliptin, I'm sure these names ring a bell to you, then you would actually take it either iftar or suhoor. It really doesn't matter. But the drug that I really want you to remember is if you're on a particular drug a group of drugs known as sulfonylureas, these are the culprits that can actually reduce your blood sugar. So the examples of these are like gliclazide, glimepiride, glibenclamide. So if you're on any of these drugs, we generally recommend reducing the dose of these drugs. So if you're taking once a day after iftar, you can take it after iftar, but the dose will need to be reduced. And if you're taking it twice a day, then you can take it after iftar and suhoor, and it needs to be reduced. So this is the group of drugs that we worry about and are the ones that actually cause your blood sugar to drop. And finally, if you're on a ripaglinide, then you're taking it 3 times a day, then you reduce to twice a day at iftar and suhoor. Now, coming on to some other injectable drugs, if you're familiar, some of them are on exenatide. Then you can take it before iftar and suhoor. I'm not going to go into too much of details. Liraglutide, dulaglutide, you can take it anytime. And then coming on to insulin, depending on the insulin that you're taking, if you're taking a long-acting insulin, which you normally take, if you're taking it once a day, then you really need to take it after iftar. And generally, we advise to reduce it by about 15 to 30%. If you're taking it twice a day, then you can take it in the AM dose at iftar. And in the evening dose, you have to reduce it by 50% and take it at suhoor. If you're using the rapid acting, that is the ones you take with your meals, then you take the normal dose at iftar. You can omit the lunchtime and reduce the suhoor dose by about 25 to 50%. And if you're on the pre-mixed version, like the Mixstar, then you can take it, and if you're taking it once a day, you can take your normal dose at iftar. But if you're taking it twice a day, you take your morning dose at iftar. And we tend to advise to reduce the evening dose by 50% and you take it at suhoor. But if you're taking it 3 times, then you omit the afternoon and you adjust the dose and take it at iftar and suhoor. So this is just a general guide and happy to share it. And we have further information, which we can share with you later on. So that's about diabetes, and I hope that will help you in general. But if you have any questions at the end, I'm more than happy to clarify anything. Now moving on to high blood pressure. So most medical studies have shown that patients with high blood pressure can complete their fast if they have no complications or other medical problems. So there's not been a negative impact on your blood pressure balance so much so when you fast. But I can give you some tips and advice to follow during Ramadan. Is, as I always said about diabetes, you need to see your doctor to make adjustments to your medication doses. And they will tell you the best time to actually take them. Normally they're taken between iftar and suhoor. And they can also determine if you need to change your blood pressure medication to a more long-acting one so that they can be taken at night once or twice a day without having an effect on your fast. So my advice to you is to drink plenty of fluids and unsweetened natural juices, make fruits and vegetables an essential part of your Ramadan meals, as they are an important source of potassium and they can actually help control your high blood pressure. Avoid caffeine, drink a lot of fluids, and reduce the amount of high sodium foods because it can actually make your blood pressure get worse. And replace these with green vegetables. Grilled fish is actually quite good, at least twice a week, and it has a healthy fat called omega-3, which actually helps to regulate your blood pressure and prevents you from having heart problems. And it's a good source of omega-3, like for example, salmon and sardines and things are high in omega-3. And eat low-fat dairy products because calcium actually plays an important role in regulating the blood pressure and it helps to improve your bone health. Now, avoid processed meats and cheese because it has a high concentration of sodium, which can also, like I discussed before, can make your blood pressure get worse. Be aware of the warning signs, like for example, dizziness, headaches. If you experience any of these symptoms, you should seek immediate medical advice and perhaps break your fast. Now, measure your blood pressure regularly. It's a really good opportunity to lose weight. Quit smoking as it raises your blood pressure. One of the indicators, the systolic blood pressure by at least 20 millimeters and significantly increases the risk of heart attacks and strokes. So continue exercising during Ramadan and it really helps to regulate your blood pressure. So I've just given you a chart here of some of the medications, commonly used medications for blood pressure and how you can actually adjust it during Ramadan. So bisoprolol is usually used, to slow down your heart. And if you have other cardiac problems as well, we call it commonly as a beta blocker. And usually it's taken once a day, which you can take after suhoor. Metoprolol is another beta blocker that's often taken twice a day, and you can take it at iftar and suhoor. Now, ACE inhibitors is a group of medication that we commonly use for high blood pressure. And some of the examples are your losartans, your ramiprils, your perindoprils. And these are usually taken once a day, and it can be taken after Isha. But what you need to worry about here is, your blood pressure when you stand up, especially if you're going for Taraweeh prayers or you're praying your Isha prayers, it can kind of, when you stand up, it can drop your blood pressure slightly, which we call as postural hypertension. So you need to be aware. That's why I said, have it after Isha. Then you have a group of drugs known as calcium channel blockers. Those drugs are, you might be familiar with a drug called amlodipine, nifedipine. These are recommended after iftar or suhoor. And then you might have drugs like verapamil, diltiazem that you're on. You can take it after suhoor. Now you have a group of drugs called thiazide diuretics. You might commonly know them as water tablets. They are taken once a day after Isha. Then you have alpha blockers like your doxycycline. You can take that after Isha, but beware of the postural drop. That is when you actually stand up for your blood pressure can drop. And a separate drug of drugs like hydralazine, which is sometimes taken 3 times or 4 times. And you can take that twice a day. Now, the next disease that I want to talk about is the long-term disease is for those that have heart problems. So in general, fasting has no negative impact on patients who have stable heart conditions, if you do not have symptoms like chest pain, shortness of breath, then you can fast. It actually could be beneficial because you lower your food intake, you abstain from smoking, we think that your stress levels are reduced during the month of Ramadan. So this will actually help to reduce heart disease risk in general and also have a positive impact on people with heart conditions. However, I recommend that you consult your cardiologist because you might need some medication adjustments, especially with your timings. They might substitute ordinary medications with long-lasting ones, so it will fit with your Ramadan plan. Because you have to fast for, approximately 15 hours in some areas. So if you have stable heart conditions, you can fast. However, it is advised not to fast if you have the following. Like if you experience recurrent chest pains, if you have heart failure, and you experience extreme fatigue, loss of energy, or you feel short of breath, because you will need frequent adjusting of your water tablets. Patients who have suffered heart attacks should not fast within the 6 weeks following a heart attack. If you've had open surgery, you should not fast within the 6 weeks following surgery. Patients where they have heart's aortic valve is narrowed, we call it stenosis or inflamed, it's ideally recommended that you do not fast. Heart patients who are on blood thinners, or if you have, an irregular heartbeat, and you have problems with it and it's not properly controlled, then it's recommended that you do not fast. Or patients with heart conditions that require constant observations, you've had frequent hospital admissions, then you ideally should not fast. Now, what we recommend for heart disease patients is to have smaller food portions, because smaller food portions trigger favorable hormonal and metabolic changes, which will increase the production of good cholesterol and actually decrease bad cholesterol. The outcome of these factors will be best if you can also manage to reduce weight. So avoid fatty foods and salty foods, as well as large quantity of beverages, which could lead to shortness of breath, especially if you have heart failure. Consume smaller meals instead of large meals and maintain physical exercise, even by taking a short walk. Now, these are some of the common medications that majority of them use. Even when your cholesterol is high, some of you on cholesterol. So I put this if you're on any cholesterol medication, so it will help you to understand when to take your medications. If you're on atorvastatin or rosuvastatin, then you can take it after iftar or suhoor. It doesn't matter. But if you're on simvastatin or pravastatin, then take it before bedtime. If you're on a drug like fibrates, fenofibrates, then you can take it after iftar. If you're on a drug called ezetimibe, then take that after iftar or suhoor. It really doesn't matter. But the reason I put loop diuretics here, because if you patients with heart problems or have heart failure, they are on diuretics, and it is recommended that you take them after Isha. So I'm not going to talk too much about liver diseases, but I will just give you a brief idea about liver diseases and fasting. So a majority of the patients with liver patients with stable, if it's stable, you can fast. However, patients that have acute hepatitis, varicosities in your esophagus, which is the food pipe, or you have a swollen tummy that we call as ascites, or hepatic encephalopathy, that's a liver disease affecting your brain, you should refrain from fasting. Or if you have chronic liver disease, if it's stable, you can fast during Ramadan without much complications. It might actually help to get rid of your excess fat surrounding your liver. But if you have late stage liver disease with complications, then it is advisable that you do not fast. So the advice that I can give all liver disease patients to have healthy dietary practices and have a balanced diet. Break your fast with a light sweet drink, have a prayer break, and then have your meal. Your meal should consist of carbohydrates, fruits, proteins, with minimal quantities of fat, especially for fatty liver patients, and a lot of fluids to prevent dehydration. Foods like cereal, fruits, vegetables, meats, beans, milk, oil, in addition to fiber-rich foods such as whole grain bread, rice, fruits, and vegetables are good for you. And you should avoid fast foods, including deep fried food and raw uncooked food. Now, break your fast if you feel dizzy, if your skin is pale, because that might indicate that you have jaundice, the liver disease is advanced. And also the time to take if you are taking medications, you can either take it at iftar or at suhoor time. So we've come to fasting and kidney disease. So chronic kidney disease is a long-term condition which involves actually gradual loss of your kidney function, and you have 5 different stages that your doctor can discuss in detail with you, and I'm sure you already know. Now, patients with acute kidney disease should not fast until you have fully recovered. But if you have chronic kidney disease, like I said, you have different stages. If you have stage 3 chronic kidney disease or higher, then it is advised that you do not fast. However, below that, if you're stable, you can still fast. You need to abstain from food and water. This is because you need to actually abstain from food and water for long hours, and it can lead to dehydration and cause further kidney damage. So this is one of the reasons we advise people who have kidney stage 3 or above not to fast. Now, those who are on dialysis, patients that undergo, usually sometimes they do it 2 or 3 times per week, you need to have IV fluids. Therefore, it is advisable that you do not fast. However, if you have days that you do not fast, based on your doctor's advice, you do not have a dialysis, then you can fast in those days, but do consult your doctor to see if it's okay for you. Now, people with kidney transplant patients are also advised to refrain from fasting because they need to comply with their prescribed medication doses and timings. And patients should not skip suhoor to avoid body weakness because they need more calories than individuals that are in good health. Now, if you're having kidney disease, you need to particularly take special caution and avoid ingesting high quantities of sodium, potassium, and phosphorus. These are salts, especially during Ramadan. because sodium contained in table salt, as like in potassium, which you get in certain vegetables like tomatoes, potatoes, and some green leafy vegetables and some fruits, including bananas. You should try and avoid too much of it. Phosphorus is also found in beans, carbonated drinks, nuts, and dairy products. So be careful if you have kidney disease. Just avoid excess of these if you're deciding to fast in Ramadan.
Okay.
And
Sorry, I think we are overrunning 10 minutes extra. So I just want mindful of little bit of mindful of time.
okay, I'm really coming to the end now. This is probably the last slide, and then pregnancy. I can skip asthma if you want me to.
Yeah, so you can give a brief one. So.
Okay, and I'll just skip this in the interest of time, and I'll just talk about pregnancy. Well, it is not advisable for generally for pregnant women.
Turn left.
You can fast, to fast, especially if you have complications during your pregnancy, such as diabetes, high blood pressure, or anemia. However, if you're fit and you decide to fast, then it is advisable that you speak to your doctor and make sure that you follow up regularly, have your antenatal appointments to make sure that it is not affecting your baby. Take a lot of rest throughout the day, have the right kind of nutritions, drink a lot of water, avoid sweets and sugary snacks. I think we've mentioned this many times. Now, why we actually ask pregnant women not to fast is because it can affect your baby's growth. And fasting has been actually linked. There's a lot of scientific evidence that it has been linked to premature labor. And it can cause dehydration, can also have an impact on preterm labor and your baby born early, preterm birth. So some people can experience nausea, low birth weight, dizziness, and your metabolism actually slows. So if you are pregnant and you decide to fast, then you should really seek medical advice. If you're not putting on enough weight or you're losing weight, if you tend to urinate frequently, you have smelly urine, it might indicate that you're dehydrated and you have a urine infection. If you develop headache, other pains, nausea, and you start vomiting, or you feel that your baby movements are changing, or you're not feeling baby movements, or you develop pains, contraction like pain, which could be a sign of preterm labor, or you're feeling dizzy, faint, weak, or confused, then you need to break fast. Listen to your body, basically. And for breastfeeding women, generally women whose babies are less than 6 months, they totally depend on breast milk. So it is really advisable that you do not fast. But however, if you have older babies that are also taking other supplements, then you can fast, but you need to make sure that you actually drink plenty of fluids. You make sure you have a balanced diet. But however, if you feel that you are dehydrated, you're feeling very thirsty, dizzy, weak, very tired, or you're worried that your baby is not getting enough milk, then please do break fast. It is really not recommended to feed if you're breastfeeding. But having seen so many patients, some of them actually insist on feeding, then this is my advice to them. So finally, my take-home message is prioritize your health. Islam allows breaking the fast if it endangers your health. Consult your doctor regularly to make your medication adjustments. Eat smart, stay hydrated, balance your meals to maintain stable blood sugar, and listen to your body. If you feel unwell, stop fasting and seek medical help. Thank you.
Thank you, Shezoon. It's a very comprehensive, talk. Actually, it's we gave a bit extra time, but it's worth, listening to you. Lots of perspective in terms of a different area of chronic diseases. So there are lots of guests joined in this meeting from all over the world. I think some of them speak different language. So the time for a question and answer session, so people can speak, Tamil or Sinhala, they can ask the questions. So I think is Dr. Shezoon could able to speak very good Sinhala as well. So she will answer on that way, and we also can answer in Tamil. So anyone has any question, they welcome to ask their native language. Begin with, I have one questions from one of our participant, is for Dr. Mohideen. There are patients with a high blood pressure medication. We recommend after iftar, after food, but the one guest is asking, if the patient was asked to take an empty stomach, how do we do suhoor time? You need to wake up very early to do that medicine, and then you need to give 1 hour gap. So how do we do that?
Well, obviously, if you're fasting, you can't take it. You have to take it. You can take it soon as you break fast, actually, before you take your meal. Like I said before, with a little, water or zamzam or date, and then you can give a gap, and after that, have your meal.
Yeah, this is what I also suggest. The majority of the blood pressure medicine should be taken after iftar, that is a break in time. So you can have a sip of water and get medication, and then pray Maghrib, little bit of gap, and then eat your food. That will be the best idea. And so is there any other questions? Brother Hasim, you can unmute if anyone, if your group is
Yeah.
unmuting.
Yeah, exactly. And doctors, Shezoon, you can stop sharing the screen.
Oh, sorry. Let me just stop that.
All participants feel free to ask your questions. It's time for the participants to ask questions. Feel free to add. We have some other consultants, and then so please, it's your time. Both are experienced doctors, Dr. Jawahir and Dr. Shezoon. So they are here to answer your questions. It is open for your questions. Feel free to ask in any language. It can be English, Tamil, or Sinhala. Even in Arabic, of course, Dr. Shezoon can answer in Arabic also. So feel free. Please, it's open for you. You can unmute and ask your questions. Questions, suggestions, comments, anything, it's open.
There was things that I would like to add while the others are preparing their questions. There was a study done in Jeddah. It's a very interesting study. They did a group of community in Jeddah, and they were looking for expenditure during month of Ramadan, and then weight changes among the people while fasting. So interesting factor, they noticed that a 20% increase in expenditure during month of Ramadan, especially on the food consumption. So the fasting meant to reduce the expenditure, but apparently it's increased by 20%. And also the people they involved on the studies, it was published quite some time ago, I forgot when was it, is about 20% weight gain happened from 1 kilo to up to 10 kilos. So it is quite interesting factor that, even the fasting is meant to help us, our health conditions, reduce weight, mindful of eating, but it still is working other way around if you don't do, proper, methodological, scientific method while we are fasting. So we should avoid, high calorie food, high sugary food, always consume with the complex carbohydrate, sort of things. So just from your thoughts, I gave some statistics which was done in Jeddah in Saudi Arabia.
Dr. Jawahar, there are a few questions in the chat box.
Okay. Yeah, just to read about.
What about constipation during Ramadan?
Yeah, there are a few questions were asked. We start with how do we handle the constipation during Ramadan? Dr. Shezoon, you would like to answer, or shall I?
Yeah, well, I think throughout my presentation, I reinforce the fact that we should have high fiber, in our diet, drink a lot of fluids. So this is the main problem, that we eat a lot of fried food, oily food that doesn't really help with our our bowels. So you have to have a high intake of vegetables, fruits that are rich in fiber, and also drink plenty of fluids. This will actually help you to prevent developing constipation. However, if you do develop constipation, then there are medications that we can advise you to have. Some of the natural things like isfagullahak, and there are other over-the-counter medications as well that you can take. But ideally, we want to avoid medications by maintaining a very healthy diet. Fruits, vegetables, fiber containing.
That's true. The other question was one of the guests is asking the thyroid medication. As you know, it's a thyroid medication should be taken in empty stomach. So again, we go back to the same kind of rule that, during the iftar, is just take with the a bit of a water with the medication, and then give a gap. It's about 20 to 30 minutes of gap you need to give. So after Maghrib prayer, you can start your food. So I think iftar time is the best. Shezoon, I would like to ask. I think one of the question is asked whether we could able to use eye drops, ear drop, nasal drops during the fasting.
Eye drops, yeah. These drops, actually, anything that doesn't provide nutrition, you can use. So you can use your eye drops. You can, some people have questions about whether you can give blood. This is also allowed because you're not injecting anything into your body that is providing you with nutrition. So these are medications, so go ahead. It's absolutely fine to use them.
So some of the questions were individual questions were asking about the medication, metformin and vilgliptin, and so I think is that these are very individual questions. Already, Dr. Shezoon has given the breakdown of the medication. We will happy to share the slides if anyone wanted. Please contact Brother Hazim or either me or Dr. Shezoon. We will share the links. However, it's very important to consult your medical practitioner to adjust the medication or reduce or increase reduce the medication, or even change of the medication if you find it difficult during the Ramadan. Other questions ask, urine infection is more common during the fasting. So again, go back to the basic things is water, and hydrate yourself. It will be much better. It's especially the urine infection, very, very common in the female, and also it's common in children who are able to fast. So let them encourage to drink lots of water. So these are the questions so far asked. I would like to throw a question, Dr. Shezoon. Can we swim during fasting?
Well, I think you can swim. There's no problem as long as you're not swallowing water and ingesting water in. Yes.
Yes.
All physical activity, you can do it as normal. There's no problems. It's just that you need to take care that, you're not doing anything vigorous.
Yes.
That is going to affect because you are fasting, but otherwise it's fine.
Yeah, one of the questions this was asked during the masjid presentation when we do a few years ago, the swimming. Yes, you can do swim as far as your course is about. You can accidentally swallow water, or if you do underwater swimming. So try and avoid the swimming or deep swimming. Is to do the swimming over the water, which is not dipping your head down. So that's you can do, and don't swim in the hot sun. Some of the in UK is okay, but some other places, a swimming pool outdoors, so make sure you're not swimming in a hot sun. We don't see any other questions. So one of the other questions is commonly asked is heartburn, gastritis symptoms during fasting time. Is there any particular advice you can give, Dr. Shezoon?
I think, some of you already are on the medications, like, you have medications that if you are known to have gastric problems, then you can take things like omeprazole, pantoprazole, lansoprazole. I'm sure many with chronic diseases are already on them. So you can take that to reduce. But the other thing is to really avoid oily, spicy food before suhoor and after iftar, because this can make things worse for you. So the main thing, key thing is spicy and oily food can increase the acidity and cause more, reflux and heartburn. So therefore, avoid these. I think it's really about the healthy behaviors and diet that we follow that can make our Ramadan experience better. So that's the reason in every slide of mine, I focused a lot about healthy eating. So try and avoid these. And if it's really bad, even after you followed a really good, healthy diet, and you're already, because some people will tell you that I am actually not having oily food, I'm having fruits, I'm having a healthy diet, but I still have, then it's probably, you do have a bit of a medical problem with indigestion, and then you will need some medication, which you can take at suhoor time.
Is that a girl? Where's that?
Mama. Yeah, thank you very much, meeting your volume. So the next questions, it's not asked here, but I would like to ask, because commonly when I do the most presentation, they normally ask, can we use inhalers during fasting? Is there any particular advice, Dr. Shezoon?
Yeah, I was actually going to cover this in the asthma part, but inhalers are fine. They don't provide you with nutrition as such, so you can use inhalers. It's absolutely fine. It doesn't break your fast.
That's fine. Thank you very much. Is there any questions from any of the guests? Even the chat box I'm just going through, it's not that much question. We have covered majority of the areas. Brother Hasim,
there was one, I don't know, they covered it. I think it's covered under pregnancy. Does breastfeeding make you dehydrated while fasting?
Yes. Yeah, I missed that one. Yeah. Yeah.
Yes, it is not recommended that you breastfeed, especially, if your child is totally dependent on breastfeeding in the first 6 months, because it can reduce the amount of breast milk unless you really keep yourself hydrated and drink a lot of water between suhoor and iftar time. So generally, it is recommended that you don't breastfeed because it can cause a bit of dehydration.
Some of the common people have a myth that giving a blood test during fasting, will break the fast. It's actually not. You can give blood test. Investigations are allowed. Blood investigation either is the finger prick or venous blood, which is normally taken from the vein for the testing. Yes, it's allowed, and it won't break the fast.
Yeah, and some of them actually have concerns about the injections that you take, the intramuscular injections for pain. Yes, they do not break the fast, so you can still take them. So if you're in pain and you want to still carry on fasting, yes, the intramuscular injections does not break fast.
So I think we have covered majority of the stuff. Anyone want to ask anything in Tamil or Sinhala or any other language? you're welcome to ask questions. You can only mute your volume and then you can speak. Sorry, unmute and you can speak. So one of the questions now is coming through. If you have diabetes, you get really bad headache during the fasting. Your eyes hurt too. Would it affect us? So I'm not very clear on the questions. Of course, yes, during the diabetes, if you have a diabetes during the fasting, you can have a headache. Yeah, I think it's the corrected. Should we break the fast? Yes, the headache is one of the signs of probably it's a low sugar, but there are other things also can cause headache. Hypovolemia, which is poor water intake during the time of the fasting, so that also can give headache, and a low sugar can give headache. So if you have an unbearable headache during the fasting, if you are diabetic, it's safe to break the fast rather than you get sick and further medical attention needed. Yes, but you need to make sure that you speak to the sheikh or scholars how to do the fidya after the Ramadan.
There is another question, doctor. Do you recommend fruits for iftar after breaking fast for diabetes patients?
Yeah.
It's recommended, is it? Yeah.
Yes. Yes. Is food? Sorry. The after iftar fruits are encouraged, especially the watermelons and as Dr. Shezoon said, the cucumbers and the water is a water-rich fruits is well recommended. So yes, you can eat apple is no problem. Oranges, those fruits are well recommended. Watermelon is the best, is because of the loss of water volume in there.
Yeah, I think we are coming to about 1 hour and 15 minutes now. I think we'll have 2
Assalamu
minutes.
alaikum.
Yeah, please go ahead.
I have a question regarding the metformin tablet. If you're only taking metformin, there any side effects from that? You can face like like a kidney.
I cannot keep this. My stuff will only post.
Yeah, Dr. Shezoon, you want to answer? Did you understand the question?
Yeah, I think you're asking, are you diabetic, or is that why you're taking metformin, or are you taking it for some other reason?
And the diabetic metformin.
So you can take metformin, it's fine. As long as your blood sugar levels are controlled, you can take, if you're taking it once a day, you can take it after iftar. If you're taking metformin twice a day, then you can take it after iftar and suhoor. You should take your medication as prescribed and not stop it during Ramadan. Particularly, that's the mistake that a lot of people do. They think that I'm fasting, I'm not eating, so my blood sugar is going to be controlled, so I shouldn't take my medication. So please do take your medications, and it's fine for you to take it. It's safe if you have been taking it for some time and you're stable on it and your blood sugar is controlled, then you should carry on taking it.
Just to add on that question, so metformin normally doesn't reduce the sugar that low. It doesn't cause that much of hypos. It doesn't come under sulfonylurea tablets, which is Dr. Shezoon mentioned, like glycoside and the glimepiride and the other things. So the metformin is safe to take. You can take it as prescribed. So I think those are the questions. There anyone else wanted to ask anything? So So yeah, that's one question coming through. The urine infection more common. Yes, we covered urine infection is a majority time is plenty of water. That's a key to prevent the urine infection during month of Ramadan during fasting. Yes. I think it's a time for us to finish the session, and thank you very much, Brother Hasim, and also the other members of the World Forum to arrange this event and inviting us to join this meeting and facilitate this talk. And thank you for all the guests who has joined for this valuable sessions. And Dr. Shezoon, thank you very much, especially your hard work. I know you were on a holiday, still you managed to prepare the comprehensive, organized presentation with the lots of information people to take it. And so thank you very much for your presentation. Brother Hasim, you want to add?
Yes. Jazakumullah khairan, Dr. Jawahir and Dr. Shezoon. It was, I'm sure it was really very informative and helped the participants. So if you have any questions, you can contact us through our email sg@wfslm.org, or one of us, we are contactable. Contact Dr. Shezoon, Dr. Jawahir, they are all available. These presentations, if you want, please contact one of us, and inshallah we will try to arrange it. On behalf of the chairman, the Health and Wellbeing Committee of World Forum and the members, I would like to extend my sincere gratitude to Dr. Shezoon and Dr. Jawahir for taking time to prepare and be with us for presenting and answering all the questions. They're busy with their own work and their family and their schedule. Jazakumullah khairan. May Allah bless you all and keep you strong to continue your services for the benefit of the community. And I thank all the participants for taking time and joining us, and for the questions, very relevant questions, and be with us for the last 1.5 hours. And inshallah, we look forward to see you once again in another forum. Jazakumullah khairan. Let's conclude with dua. Subhanallah, subhanakallah, bihamdika, ashhadu an la ilaha illa anta, astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh.